Every 40 seconds in the US, someone's life is turned upside down by a stroke. And sadly, every 3 minutes and 14 seconds, a life is lost to this sudden event. These numbers aren't just statistics, they represent real people, someone's friend, family member, or loved one. Here's a staggering fact. About 34% of the global healthcare budget goes to managing the aftermath of strokes. So, let's unravel what strokes are all about, why they happen, and how recovery can unfold. Imagine your brain as this incredibly complex network, buzzing with activity and controlling everything from your thoughts to your movements. Now, picture that network being disrupted, either by a blockage cutting off the blood supply or a vessel bursting, causing bleeding. That's what we call a stroke. Most strokes, around 85%, are what we call ischemic strokes. It's like a roadblock in your blood vessels, stopping oxygen-rich blood from reaching your brain. This roadblock can form in two ways. Sometimes, it's because of a blockage that forms within your blood vessels, like from hardened arteries. We call this thrombosis. Other times, a clot travels from elsewhere in your body, like your heart, and gets stuck in your brain's blood vessels. That's embolism. Then there's the less common but equally serious type, hemorrhagic stroke, which accounts for about 15% of cases. Think of it like a pipe bursting in your brain, causing bleeding. There are two main types here: intracerebral hemorrhage, or ICH, where blood leaks into the brain tissue itself, and subarachnoid hemorrhage, or SAH, where blood fills the space between your brain and its outer covering. Recognizing these strokes quickly is crucial. They can escalate rapidly, leading to sudden changes in consciousness and function. The key signs to watch for include sudden numbness or weakness, especially on one side of the body, confusion, trouble speaking or understanding speech, difficulty seeing in one or both eyes, dizziness, loss of balance or coordination, and a severe headache with no known cause. These symptoms can come on suddenly and worsen quickly, so prompt action is essential. Now, what happens after a stroke hits? The journey to recovery starts with immediate and rapid response, then moves into a more personalized rehabilitation phase. It's all about quick action and a lot of heart and resilience. When a stroke occurs, emergency responders are the first line of defense. Their job is to stabilize the patient and get them to the hospital as quickly as possible. Whether in a general emergency room or a specialized stroke unit, the aim is to conduct a thorough evaluation, including imaging and lab tests, all within a tight time frame. For ischemic strokes, the main goal is to dissolve or remove the clot causing the blockage. This can be done through medication like aspirin or tissue plasminogen activator, TPA, which helps dissolve clots, or through mechanical removal with a procedure called thrombectomy. In the case of hemorrhagic strokes, the focus shifts to stopping the bleeding. This often requires neurosurgical intervention to repair the ruptured vessel or relieve pressure caused by bleeding and swelling. Patients are usually closely monitored in the ICU to ensure stability and manage any complications. After the emergency phase, the treatment plan is customized to the individual. For minor strokes, supportive care might be enough. But for more severe cases, surgical interventions might be needed to address underlying issues and prevent further damage. Recovering from a stroke is like putting together a complex puzzle. It involves a team of therapists helping survivors regain lost skills and independence. Physiotherapy, for instance, plays a crucial role in getting your body back in motion. Therapists use different approaches tailored to the patient's needs. Occupational therapists focus on helping patients master everyday skills again. They assess how the stroke has impacted their ability to perform daily tasks and develop programs to improve those skills. This could involve suggesting modifications to tasks or the environment, like prescribing assistive equipment or recommending home changes. They also help with cognitive therapy, addressing issues like attention, concentration, and memory through various strategies. Speech and language therapists are there to help with communication and swallowing difficulties. Their work is crucial in helping patients regain their voice and ability to communicate effectively. They use impairment-based approaches to target specific language components or functional communication approaches that focus on practical skills and environmental modifications. Orthotists also play a vital role by designing and fitting custom-made devices like braces or splints, helping to manage mobility and ensure safety. If you found this video helpful, don't forget to like, share, and subscribe. Let's spread the word and work together to reduce the impact of strokes.